Hello, this is Nelson Marquina. I just wanted to give you a quick introduction to the seminar I'll be presenting at the Spring Convention coming up in the WCA. The title is Knee Chronic Pain and Neuropathic Pain Management. So just to kind of give you a quick overview on that, we're going to learn in the seminar, definitely recognize the difference between neuropathic versus somatic chronic pain, like osteoarthritis. Then we're going to look at the treatment protocols, including rehab programs. And there's a difference. How to treat neuropathic pain is different from somatic pain. We will cover both, but the focus, of course, will be on neuropathic pain. They go over briefly on the type of lasers and how best have to use them, definitely. And at the end, we're going to a combination of how do you combine e-stim, TENS and microcurrent and all that, ultrasound and lasers. Notice the seminar focuses on knee pain, but the contents are applicable to all joints. So that's it's a metaphor. It's only 4 hours, so I would use knee as a metaphor for all joints, and you will see that this is applicable to any joints that we have. We all have seen the typical OA, knee, in this case, a knee, for example. But the problem is neuropathic pain is a little bit different. They kind of masquerade, and we'll go into the techniques how to treat the joint itself. All right, here's on the lateral side. We're going to infrapatellar if there's some issues on the below the patella. Same thing on the medial side of the knee joint. So really, the objective is to bathe the whole knee joint, if that's what we're treating local tissues, including, of course, the supporting structures, muscle, in this case, the quads. So we're looking at both the pathology of the knee joint and also the performance, the function, which will be focused on the knee, on the muscles. Right now, problem is what happens if the pain keeps coming back. We do the best we can on the joint, but the patients are not happy about that. Why pain keeps returning? See, what happens is somatic joint pain, like OA, eventually leads to pain sensitization of the PNS and or the CNS. So that's kind of one of the issues on chronic somatic pain. Neuropathic pain usually hides under the somatic chronic pain. So those two things are working at the same time in most cases. So if the pain keeps returning, we had to treat the neurological sensitization or the neuropathic components. So that's how we have to kind of address that. And yeah, we will go into that. In 4 hours, you will learn all those things. Pain sensitization, why that is the case, how it happens. Initially starts on the dorsal root ganglion and the dorsal horn, and I'll show you how to treat them, how to find them, how to access, how to treat them in there. And I'll show you the techniques of treating the DRG, not Dr. Mathisi. You will understand why he's pushing, why he's doing it the way he's doing it. There's a reason for that. So same thing in this case, the dorsal horn. How do you treat the dorsal horn? Including cases like in this case, in dark skin. How do you compensate? How do you adjust your laser settings of the different situations with this body hair, tattoos, moles, dark skin, like in this case. So we'll go, and I use a lot of videos to demonstrate it. Again, because we don't have much of the hands-on time with 4 hours, I would rely on videos and case studies. Case studies from doctors in the field have been using laser for many years, like Dr. Zilke, for example, neuropathic pain. This is an infrared image, so I will use that, and the same thing for videos. Now, if it is central sensitization, this is important. With peripheral and central, we will talk about both. The central sensitization, we have to treat the sensory cortex itself. But even in that case, which is the extreme case really, I'll show exactly the landmarks, where to put the laser, how long to treat, and both with pictures and videos. Yes, we also will talk about how laser therapy works, kind of the physics behind that. There's a laser emitter, the cell, why do that? Factors that get in the way, or favorable factors, positive and negative factors. But in all cases, what I'm going to use, I use analogies. Rather than using formulas, low power density versus high power density, same thing for wavelengths, energy, dose, and all that. Using analogies so we can understand conceptually what it is, and it's easy to understand, and more importantly, how to use them with patients. So rather than having a bunch of formulas that they're unwilling to use, I'll discuss also the best wavelengths for the different. See, there's no one wavelength that's good for everybody. You will show what's called tissue affinity. So yes, I'll show that, go into the details on that things. And probably the most important thing, I'll show you how to build this table for your own laser. Here you have the tissue depth, right? The different target tissues and the tissue volume, the target tissue, with small, medium, or large. And in each case, whether it's chronic or acute or neuropathic, so there are 3 tables really, one for acute, one for chronic, and one for neuropathic pain. But in any case, I will show you how to calculate your average power, your pulse power, your duty cycle, and the pulse rate. So you will have a table for all of those things. So patient comes in, you know the target tissue volume based on imaging, physical diagnosis, however you do it, you know approximately the depth of the target tissue. And this table will tell you the settings for your laser. So that we will do that in the class. By the way, as you mentioned, last time I did this, this class was for Pennsylvania in the fall convention back in October. But that was a 10-hour hands-on. So we had to, actual machines there to be using with real patient cases rather than videos. And so I hope to see you then coming up in the Spring Convention in Brookfield in March. I will be talking about chronic and neuropathic knee pain management. And that will be on Friday from 8 to 12. Again, one more time, is even the focus, the knee pain for the seminar. The contents of this seminar is applicable to any and all joints. So I hope to see you very soon. Thank you. Bye-bye.